歡迎大家。
Welcome to the media briefing for COVID-19 today. Today we have the Undersecretary for Food and Health, Dr. Choi Dak-yi, Dr. Zhuang Shuk-kwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Linda Yu, Chief Manager, Clinical Effectiveness and Technology Management Hospital Authority. Dr. Choi, please. Friends of media and members of the public, in the past week, we have had 51 locally confirmed cases. For untraceable cases, there were 22. For asymptomatic cases, there were 13. The COVID-19 vaccination program has commenced since 2 weeks ago. So far, 130,500 people have been vaccinated with the first dose. Starting yesterday, those in the priority groups can choose to be vaccinated with BioNTech besides Sinovac. In light of the supply situation and the progress of vaccination, starting earlier this week, we have accepted the framework recommended by the Joint Scientific Committee to expand the coverage of priority groups, so that 7 groups of people with higher contact and infection risk can make appointments for vaccination. At present, all eligible persons can choose to be vaccinated in 27 community vaccination centers, 18 general outpatient clinics under the HA or private clinics. The 2 COVID-19 vaccines provided by the HASAR government are all considered safe, effective, and with quality assurances by experts. The benefits of vaccination outweigh the risks. Whichever vaccine you choose, you should read carefully the vaccination fact sheet provided by the CHP of the Department of Health. I would like to highlight 2 points. First, if you have a record of severe allergy, or if you have severe allergic reactions to any drugs or vaccines, please do not make an appointment before consulting your family doctor or an immunology or allergy specialist. 2, if you have chronic disease or if you have other disease so that you are unsure whether you should be vaccinated, please do not make an appointment before consulting your family doctor or the attending doctor. Vaccination service is available from private doctors who have enrolled in the vaccination program and the 18 general outpatient clinic under the HA. Members of the public can choose to be vaccinated during follow-up consultations or after follow-up consultations. The government will continue to closely monitor any adverse events after vaccination according to the ongoing surveillance system and active surveillance. Testing is also a key to prevention of disease. Currently, there are different members of the public who need to be tested. For example, workers working at scheduled premises or in the catering sector, construction site workers, teaching staff, residents and staff who are subject to compulsory testing, and also citizens who have received an infection alert from the Leave Home Safe app. Besides submitting a default saliva sample, they can also receive a free test in community testing center. As at 9 a.m. this morning, the appointment rate for the coming 7 days in the 19 community testing center is only 30%. There are still 160,000 appointment places available. Citizens can make use of community testing center and mobile testing center to get a test. To facilitate testing for foreign domestic helper, the Labor Department will set up mobile testing stations at 3 places with a lot of foreign domestic helper gatherings on this Sunday and next Sunday. These 3 locations are the pedestrian area on Chater Road Central, the Hengfast Street entrance to the Victoria Park in Causeway Bay, and also the entrance of Lai Chi Kok Park. Foreign domestic helper can be tested without paying without charge, and also no appointment is needed. They only have to provide the Hong Kong identity card or their passports. I hope the employment agencies and employers can encourage their foreign domestic helpers to make use of the free testing service. Dr. Chuang, please. We have confirmed 22 cases yesterday. The cases numbers are 11130 to 11151. There are 11 males and 11 females, aged between 19 to 25. There are 3 imported cases. 11130, a flight attendant from Ethiopia on ET 3614. He has the strain of M501Y. So far, we have 18 cases with this strain, and there are cases with no classification of strain as well. 11142 and 11143 are both patients, a foreign domestic helper returning from Indonesia on CX796 on the 26th of February. They were confirmed on the sample on the 12 days. And there are 19 local cases. 3 are untraceable. 11133, a retiree living on number 15 Fokwing Street. The building was subject to compulsory testing on the 8th of March. The patient was identified through the test. 11135, a housewife living in Lai King Estates Yat King House in Kwai Chung. Yat King House is subject to compulsory testing. The third case, 11151. The patient lives in Phu Chak House in Chak On Estates. The patient works as a dishwasher in the restaurant downstairs in the Diamond restaurant. He was subject to compulsory testing on the 9th of March. The patient was asymptomatic, and then the last day the patient's work was on the 10th of March. The Diamond restaurant has to be closed for 14 days, and the staff has to be tested. There are 16 other cases with links with previous cases. They are all linked with the gym Ursus. 6 are staff members and 10 are customers. Together with the case yesterday, there are altogether 17 cases from the cluster. Altogether, 7 staff members and 10 customers. Yesterday, we have visited the gym to take environmental samples, 20 of them. All of them are tested negative. The list of building subjects to compulsory testing include Yat King House and Phu Chak House. And also there are altogether 17 buildings subject to compulsory testing, including Conduit Road, Tai Kwun Court, Conduit Road number 40, Bishop Lay International House on Robinson Road number 4, May Road and May Tower, Yip Chang House in Shek Tong Joy, Cam Ning House in Bonham Road, Tolam Court in Botlam Road, Mayland Apartments in Kings Road, Queens Road West 345 to 345A, the Bonham Mansion on the mid-level, Queens Road West 293, Hollywood Road 192, Phoenix Court on the mid-levels, Le Sommet Block 2 on Fortress Hill Road, Cape Mansion on Mount Davis Road, Bon Points on Bonham Road, and also Sanchun Terrace 27 to 29 in Wan Chai. And also there are workplaces subject to compulsory testing, including Dato Street 11, Burton G Center, Dinner House, Flat 1004 on the 10th floor, and also Browse and Co. International Limited in Shangwan, the Department of Pathology, Gleneagles Hospital in Wong Chuk Hang, Tong Yin Street 28 in Sai Kung French International School, and Air Logistics, Changsha Wan Square, number 2, phase 2, 7th floor, flat 705. We also have some 30 preliminary positive cases related to Ursus, the gym. These cases are mostly customers, and some are their close contacts. Together with the preliminary positive cases, the cluster may grow to 50.
We know that when we first identified the first case, we asked the fitness center to close and asked that its workers be subject to testing and inform the customers, and they've emailed their customers. Altogether, from March 1 to 10th or 9th, after it closed, 240 plus customers who have been there. So we've arranged for all of them to be sent to quarantine centers. For the preliminary positive case, several cases were untraceable. So I'll mention them. One is a 12-year-old girl. She went to a Catholic primary school in Pektin. March 10th, she had fever, and March 9th was her last day in school. She lives in Diamond House in Nam Chung Street. For her school, it will need to be closed for 14 days and have deep cleansing, and the students who have been at the school will need to be tested. Another case is 45-year housewife who lives in Walking Hill Road, Woodland Villas, Block 11. No particular high-risk factors associated with her. We haven't found any at this stage. And also there's someone who goes to a teacher who goes to a secondary school in Zhengguan North Shi Foundation Secondary School. The sample from her initially was actually collected from compulsory testing. It has a high CT value of 43. Another test turned out to be negative. So this case was not totally confirmed. It's only partially confirmed. She lives in Qingyu House, Chongqing Estate. Once this case is confirmed, then the school that she works for will need to be closed for 14 days, and her close contacts will need to be quarantined and be tested. The last case, untraceable case, a 57-year-old woman. She's security guard at Chang'an Estate, Chang'an House. She lives in Fookwing Street, number 13. On March 6th, she felt unwell. Her last day of work was March 10. The building itself is actually included in our compulsory testing notice. So once she's confirmed, then the place where she lives would need to be subject to compulsory testing. And yesterday, as mentioned in our press release, the restaurant, the Coast restaurant, altogether, it had got 5 cases. And we've collected some more information and tried to make contacts with more customers there to see if anyone needs to be tested. So we have we actually found 1 more confirmed cases, altogether 5 confirmed cases in association with the restaurant from 4 tables. So there were diners from 4 tables. So there were tables in the same area. So that's the end of my report today. Dr. Yu, please. By 9 a.m. today, in the past 24 hours, the hospital authority received 37 reported cases. Over the past 24 years, 1 patient at a public hospital died. 997 patients in public hospitals have died so far in the past 24 hours. Another 20 confirmed patients were discharged. Altogether, 10,694 patients have been discharged, recovered, and 200 confirmed patients are now being treated at 22 hospitals, AW community centers, and North Lantau infection control centers. 13 of them are in critical condition, 12 in serious condition, and 175 in stable condition. We've got 1,240 negative wards, pressure wards, and negative pressure wards number 665. Usage rate is 60.9%. So before you ask a question, please let us know which organization you're from. In brown jacket, please, at the back. Good afternoon. I'm from Mingpao Daily. I want to ask about the pandemic itself. Right now, the fitness center has got more than 50 confirmed cases. Have you found out the trainer and the customers, when they were working out, did they wear masks? And also, the current regulation is that there should not be more than 4 customers in the class if they were not wearing masks. So I'd like to ask the Undersecretary, do you need to tighten this regulation? If not, then the droplets, from the customers could pose harm to other customers. Would you like to follow the example of restaurants that it should be 6 air changes every hour? If you don't tighten the regulations, would you let the fitness centers to continue to operate, or would there be a super spreading event? And also, Dr. Zhang, about the pandemic, just then you mentioned that in Jiaon Estate, Fuchak House, there's a security guard, and also the restaurant there, someone who washes dishes there is also confirmed. So do you think there's an invisible transmission chain there? And also Footwing Street, number 13. Altogether, I think 4 or 5 people have been confirmed, right? How about their households? Do they live in subdivided flats? Can you give us more information on how the virus got spread? And also another question for the hospital authority today. Are there any people who passed away after being injected with Sinovac jab? The patient who passed away, did he have any chronic diseases? When did he receive the injection? Before he was sent to hospital, what about his heart condition? What was it like? And the 91% take-up rate for BioNTech vaccination, have you calculated are there any wastage of dosage of the vaccine? Any ways to reduce wastage? And earlier it's announced that a BioNTech person who took the 48-year-old, and she got chest pain, and another 53-year-old man also got in the wheel. And in Kunchong today, another gentleman who received the jab felt dizzy. So do they have any chronic diseases? What's the medical history like? On the fitness center itself, the big cluster there, the government is very concerned about it. Therefore, in evaluating our next round of social distancing measures, including measures regarding scheduled premises, we need to look into whether we need to tighten the regulations, and we will make an announcement in due course.
Concerning Fuchak House in Chakon Estate, we have had cases from this building. The case today is 11151, living in Fuchak House. The patient also works downstairs. We also have a preliminary positive case who is a security guard in that building. We cannot rule out human-to-human infection. The building will be subject to compulsory testing to see whether there are other cases. For Fuwing Street number 15, the previous cases are from different floors. The building was subject to compulsory testing, so those cases were caught. Concerning serious adverse outcome after vaccination or cases where the patient has to be sent to hospital directly from vaccination center, we would refer the case to the expert panel for investigation in detail. So I have nothing to add here. Concerning BioNTech vaccine, the 7 vaccination centers for BioNTech under the HA will keep monitoring the appointments number and work out the number of vaccines which need to be unfrozen and prepared for vaccination, and they will be used in 6 hours. We urge members of the public who have made an appointment, if you cannot come to be vaccinated, please cancel the appointment on our system so that we can take account of the number of vaccines to be prepared. Next question, please. Doctors, I'm from Apple Daily. From the gym cluster, we have 50 cases already. How many are sport coaches, or how many are students? Do these coaches coach the clients elsewhere? And do you think it is because of physical contacts that caused the infection? Concerning the case from the Department of Pathology of the Gleneagles Hospital, has he been to the gym as well? A question for Dr. Linda Yu. Are there a 70-year-old female and 68-year-old male who have received Sinovac vaccination on the 2nd of March who have passed away or in critical condition? Now, this is the 2nd week and we already have 4 fatal cases. The experts said it has nothing to do with the vaccination. Tomorrow, we will have the statistics about the disease, those patients have, for example, diabetes. So have you made a wrong judgment? Are you asking the elderly people to take a risk? And are you going to clarify the situation and apologize to the members of the public? From the gym, including the preliminary positive cases, there are already more than 50 cases, including 7 staff members. There are altogether 10 staff members from the gym. They did not work on the same day or took the same classes. During the sessions, some of them did not wear masks. Some were group activities. Some were individual classes with coaches. Those were intense exercises. So if you do not wear a mask, the droplets may travel a long way. And also the patient from the Gleneagles Hospital is also a customer of the gym. Some of those customers are customers of the Urges gym. However, they also do coaching in other fitness centers. So for those who have been to a certain place during the infectious period, the venue will be asked to close for 14 days and disinfected. Concerning serious adverse outcome after vaccination, the hospitals have reported some cases. I don't have the details right now, so you may have to wait for further announcements. Concerning COVID-19 vaccination program, we have prepared for the program for a long time. There is a dedicated task force preparing for the program, including setting up vaccination centers and also the procedures for vaccination, as well as training for the relevant staff. The guidelines have been uploaded to our website for your reference. Concerning to make an appointment, there are a lot of information that a person making an appointment should read on the website before making an appointment. For example, the purpose of the vaccines, and also under what scenarios you should not be vaccinated, points to note for different groups of people, as well as the rates of side effects and so on. There is a lot of information. After the commencement of the vaccination program, we have heard views from doctors and members of the public calling for more information to be released. Concerning these information, we need to consult clinical specialists. The Department of Health is currently communicating with experts so that more information may be released to the organizations and members of the public. So when we have these information, we will make announcements. Sorry, the speaker is not coming through the mic. There are lots of ways to disseminate information. Besides the internet, there are also paper-based pamphlets. In vaccination centers and in private clinics, members of the public can have access to these pamphlets. There is a lot of information. Maybe members of the public cannot fully understand the pamphlets, and also you may have doubts about your own health condition. So the pamphlets recommends people to seek advice from doctors before making appointments. Next question, please.
Post. First, about the gym cluster. Can you describe a bit what types of people frequented this gym in Sai Ying Pun? And were there any, among the cases, positive and prelim, are any of them teachers, or are any of them working in the financial services sector? And why is the cases spread to so many different places right now? There are several schools that said that they have stopped face-to-face classes as a precaution. Why was this measure advised to them? And about the vaccination guidelines, when will they come out, and what exactly would it be? Is it a guideline to the public health sector or to the general public overall? For the hospital authority, a question about the recent death of a COVID-19 patient. Can you describe the age of the patient and which hospital the person was admitted to? And also, following reports that another death related to the Sinovac jabs was reported, do you have any more information to share on that?
I'll answer the first question first. So for the Urshus Fitness Center, so far we have 17 cases affecting 7 staff and 10 customers of the gym confirmed. And preliminary, we have around 30 something preliminary positive case affecting mainly the clients, customers of the gym, as well as a few close contacts of those confirmed cases. So altogether, we may have more than 50 clients and staff affected related to the gym. So I understand they attend sometimes personal classes and sometimes classes in groups. And many of them do not wear masks during the training sessions. So it is inevitably that if any of them is a case, transmission will occur, especially during exercise. So our policy is that if a close contact is a school, working in a school, either a student or a teacher, if it's a close contact, we usually will advise them to close temporarily until the close contact is tested negative. For example, after admitted to the quarantine camp, so that they can reopen again. I think so. Even the cases there, they are. But because this involves a lot of close contacts, I do not have the details.
About the vaccination program, preparation of the program itself is a very thorough process, and part of the preparation include gathering information that is very vital for the potential recipients to know before they decide whether they will receive the vaccination. So this information has been gathered from information from the drug company and also from studies or from information that is available in published studies or in phase 3 trials or in other governments that have launched these vaccination programs with the particular vaccines. So this information is quite abundant already. So when an individual decides to consider to book one of those vaccination sessions, he or she has to visit the website or get one of these hard copies and go through every details before he or she decide to or give consent for the vaccination. Now it's 2 weeks after the launch of the vaccination program, and we have gathered feedback from those who run vaccination centers and recipients of vaccination that they might need to have more information, and that those information may be more clinically related. So I understand that colleagues in the Department of Health has been communicating with clinical experts in the recent while, and then when the information is ready, they're going to distribute more clinically relevant information for partners who provide vaccination and also for the public to consider. Thank you.
For cases who are suspected to have serious adverse events following the COVID-19 vaccination, hospital will report these cases to Department of Health and also Civil Servant Bureau for their information under current notification system. The hospital will also pass the information to the Expert Committee on Clinical Events Assessment following COVID-19 immunization for their further assessment.
下一個題目。
Next question, another English question. Lady here.
This is from Bloomberg. Regarding to the gym cluster, how many schools are being infected and how many are closed? And second question is the Hong Kong government considering to shut down the fitness centers, and any details on that front, and when are we gonna have the details? Thank you.
I understand at least one of the teacher of the French International School in Zhangguangou is confirmed. So the school has been asked to suspend face-to-face class and undergo testing. According to I understand there may be more students or staff affected in the preliminary positive cases, but I do not have the detail. And also for the close contacts of confirmed cases, because they need to be quarantined in camp and get tested. During that period, we will advise the school concerned to suspend for a few days until he or she is tested negative.
下一個提問。
In response to this cluster of COVID infection in this gym, the government will look at it very closely, and while we are in the process of evaluating or reviewing the social distancing measure in the next cycle, we will consider whether and how to tighten the infection control measures in this particular type of premises. Thank you.
好，下一個提問。
Lady at the back. From cable TV. I'd like to ask about the testing kit. We know that the testing kit right now, every morning, they were distributed quickly, but collected about 60,000 were distributed each day, but only 3,000 were returned. And often a person may collect several kits in one go. So is there any way to stop people from, wasting the testing kits by getting several of them each time. And also the bookings at the community testing centers are far from full. So it's said that because some of the the community testing centers charge for testing. So it's said that people, because of the fee involved, they would prefer to get several testing kits instead of getting tested at the community centers. So what would you do to improve the situation? Yeah, people may have different needs depending on maybe the particular requirements or other factors, and people actually need to go for testing. And there are actually at community testing centers, people can get tested for free, particularly for people categorized by the government as people in need of being tested. In the coming 7 days, the bookings rate are only 30%. There's still a quota of 160,000 for people to go for testing at the community testing centers. So we do encourage those who are required to be tested to go to the community testing centers in every district. Testing is free as long as they are registered and can prove that they belong to the categories required to be tested. And as for people who take the situation of people getting or taking the test kits to for getting the deep throat saliva samples, we do hope that people who don't need that many specimen collection bottles should be careful not to take too many of them, because many people also need to be tested. They should leave enough bottles for other people. On the right at the back, gentleman there, I'm from TVB. I'd just like to ask the Undersecretary, as for the vaccination progress, the Bureau is saying that before being vaccinated, the public should look enough information beforehand. So you expect the public to carefully consider the information offered. But we've seen cases of people who've actually need emergency help after receiving the jab, or even people dying as a result. So how come that this is now the second week and yet the information disseminated is still inadequate? Even for people to go online to read the information, they still may not know whether they are suitable to be vaccinated. Can you actually improve on your information provided? And also in the past 2 weeks, there are several cases of death of people after receiving the jab. It's not proven that it's related to the vaccination, but would you consider offering some sort of condolence compensation or compassionate payment to them? And also, would you classify COVID-19 related diseases as occupational diseases? And also, at the fitness center, more than 240 customers were there. Have you located how many customers? How many of them have you located and asked them to go for testing? So it seems that the fitness center, is it that the outbreak there is caused by human-to-human transmission or caused by environmental contamination? Okay, let me explain a bit here on vaccination. In the entire vaccination process, it's all a matter of personal choice and consent. Of course, we are talking about injection of a vaccine, and particularly for the vaccine involved, because it is approved by governments worldwide for emergency use. The information, of course, later is still limited, but various governments, including the SAL government, based on the information we have, and also the feedback of experts panel, we are actually, with all the information we have, trying to prevent the spread of COVID-19. And we know that the benefits of these vaccines outweigh the drawbacks. So for each individual, when they decide whether to receive a jab, for some people, it may be an easy decision because they have better understanding of their health condition. But for some others who may not be clear about their health condition and are worried, as actually mentioned in our explanatory leaflet, if they are not sure whether they are fit for the vaccination, we encourage them to first consult doctors. Can be their family doctors or any doctor they've been seeing, and so as to protect the safety.
Concerning the indemnity fund, we have secured the approval from the Finance Committee to set aside funding for the indemnity fund, so that when there are serious adverse events which are considered by the expert panel to have links with vaccination, then patients can receive a compensation from the fund. We have got a list of some 200 customers from the person in charge of the gym. We have located most of them. Most of them have been sent to testing centers last night. We think it is more probable that there was human-to-human infection. Since the first case surfaced, we have identified more and more preliminary positive cases, and we have been sending close contacts to quarantine centers. No thorough disinfection has been conducted. However, some cleaning has been done. That's why we have not found any positive environmental sample from the gym. There are 10 staff members, 7 are already infected, so it is more probable that there was cross-infection. Next question, please. The lady on the left. Hi, I'm from Hong Kong 01. About the gym in Sai Ying Pun, you said some customers would go to other gyms. So where and which are those gyms? And also, will you issue direction for gyms to be closed again? And what is the threshold? How many cases have there be for you to make such an order? And when will you issue guidelines for vaccination? And also, we will include information about patients with certain diseases or symptoms who should not be vaccinated. And how will the guidelines be different with the fact sheets now? The customers have been to several places. One customer from Ursus Fitness is also a trainer in another gym in Shangwan. Another customer also goes to H-Core to coach classes. And there are customers who went to Pure Fitness as well. However, we are not sure whether they went there during the infectious period. And also there are customers who also go to other fitness centers as customers. Concerning gyms or fitness centers, the government would review the scheduled premises, including fitness centers. We would identify ways to strengthen the epidemic control measures to lower the infection risk. That's what I meant. Concerning the guidelines, we already have a lot of information about vaccination available. After rolling out the program for a certain period of time, there are doctors or members of the public who think there is not enough information. That's why we have been talking with the clinical specialists to see whether we can provide more detailed information. It is already underway, and we will disseminate the information in due course. Next question, please. The gentleman at the back. Hi, I'm from AM730. About the gym cluster, you said environmental samples have been collected. Where did you collect them? And also, are there shower rooms in the gym? You said the customers went to the gym over several days. So what is the period? And also for those who have been to other gyms, how many customers are concerned and how many people have been tracked down? There are 2 cases. One is a retiree, one is a housewife. So where do they go usually? And are there high-risk factors? And also, a reporter asked about the indemnity fund. You said you had to establish a link to determine whether a case is eligible. So have you considered setting up a compassionate compassionate fund to provide compensation for patients. We have collected samples from handrails, sinks, tabletops, and so on. Many of the patients went to the gym on multiple days. For example, late February, 5th, 6th, 7th of March, they joined different classes. For other gyms, several gyms are involved. However, more importantly, we have to find out whether the patients went there or during the infection period. If there are such cases, we will have to ask the gyms to be closed, and also those staff members and customers will have to be tested or quarantined. Concerning the protection fund, or that is an indemnity fund, the experts panel on clinical events of vaccination would have to assess each and every case to decide whether there is a link between the events and vaccination. For serious anomalies or adverse events, they have to be provided by private doctors, and also the conclusion drawn by the experts panel. If the panel decides that there is a link between the events and vaccination, the patients will be eligible for a one-off grant under the fund. Those two patients mainly go to the Bayhall Street wet markets. Any other question? The lady in grey. I'm from Now TV. Concerning the gym, you mentioned several other gym rooms. So have you requested them to close? Do you think there is a risk? For H-Core, there seems to be two branches, one in Central, one in Corey Bay. So which one were you talking about? A question for the Undersecretary. Before providing the guideline for vaccination, do you think those people with chronic diseases should cancel their appointments and wait for the guideline to come out? And also, according to the HA, how many people have been sent to hospitals because of vaccination? How many fatal cases or critical cases? And what chronic diseases do they have? The customer who went to H-Core, the customer from the Earth gym taught classes in H-Core, in Central, and also in Taikoo Shing. If he has been to these gyms during the infectious period, we will ask the gyms to be closed. We have yet to identify the period. On the vaccination fact sheet, it says if someone has chronic disease or if there are other diseases, so that someone is not sure whether he should get vaccinated, he should not make an appointment before consulting a doctor. If he has already made an appointment, he can cancel the appointments if he thinks he should do it. The last question. Undersecretary, I'm from Apple Daily. For Sinovac, even the mainland did not give the jab to those above 60. Why is Hong Kong adopting another system unlike the one in China? Why are you assigning those above 60 as a priority group before the guideline is given? What about those who already got the jab despite having diabetes and other chronic diseases like hypertension? In deciding whether a vaccine should be given to the public, The SAR makes its decision upon the advice from the experts panel. The experts panel has referred to the scientific data and research data as well as clinical data provided by the pharmaceutical company. According to the pharmaceutical company, Sinovac, for those above 60, it says there is not enough evidence of protection concerning vaccination for people above 60 outside China. Now, in Hong Kong, we already have more than 10,000 cases. We have many elderly people who have been confirmed. For those above 60, especially for those age 70 or 80, the fatality is much higher. That's why, based on these concerns, the government think the benefits of vaccination outweigh the risk of using this vaccination. That's why we are giving this to the public. Concerning the information or clinical information, there will be more information in time. The experts have given their opinions. However, with the developments of the vaccination program, there will be more information for members of the public's reference. This is the end of the media briefing. Thank you.
不如遲啲等我哋嗰個 building list 啊。